Welcome to 7 Investing Now, a show that teaches you how to take a long-term view on investing by better understanding what's happening in the market now.
Good afternoon, good morning, good evening, wherever you might be. My name, of course, is Daniel Brooks Klein. I am the host of 7 Investing Now, and it's kind of a special episode today. So Halloween is coming up, so we decided to talk about one of the scarier topics in the United States. That, of course, is healthcare. And you can't do a Halloween topic, and it's not really a Halloween topic, but you can't have a Halloween episode without some gremlins getting in the system. So this is going to be sort of a two-part interview. There's about 12 minutes here with Dana Abmramovitz on everything facing healthcare in the US. Sort of, can it be disrupted? Will it change? How do you invest in it? And at some point, Dana disappears. And I'll come back for a second. I'll say hi. And then we've got about 8 minutes to finish the interview. Dana was having all sorts of computer gremlins. But JT Street, before we do that, if you want to pop back on, I was asked a great question on a podcast I did this morning. And I thought it would be fun to ask you, what is your go-to Halloween candy of choice? I said Milky Way this morning. That to me is just a classic. You're never upset to get it. There might be some candies I like more, but I'm not sure I want to eat 50 Score bars, and I'd be happy to eat 50 Milky Ways. What is your favorite Halloween candy of choice?
I'm a big Score fan, so I would totally eat 50 Score bars and then hate myself the next day. My dentist would hate me more. My go-to as a kid and still today is always Twix. It's a 2-for-1. It's way better than Kit Kat. I will hear no arguments that Kit Kat is better than Twix. And you could get a little one. You could get 1 or 2. They were great.
I'll go by my standard of eating a Twix when I was a kid is I will just scrape the chocolate and caramel off the terrible biscuit. I don't know why that cookie can't be better. Twix is a good idea. It's executed badly, but this is not what you wanted to hear us talk about. We're, of course, going to go to Dana Abmramovitz. If you have some questions, if you have some comments, feel free to share those. I'll try to address them. But if you want to hit this interview, and we will stay vigilant, because at some point Dana just disappears, and then I will come back for a second. So if you see me looking stunned, unfortunately, I'm in the same outfit, so you're not going to know quite the difference of the two videos. But JT, if you want to hit play, thank you for doing that. Joining me in the middle of a miserable day is our very own Dana Abmramovitz. Dana had probably the worst thing that can happen that isn't health happened to her today. Her laptop died, and that sounds bad, but usually you're like, well, I'll take it to Best Buy, I'll take it to Apple. You took it to Apple, Dana. Did they read it the last rites? Was there a little ceremony? Because it did not end well.
You know, the worst part about it is he ran this diagnostic test, and across the screen in big red letters was failed. And it just my heart sank, and I was just like, oh.
Yeah, no, you might as well get the pirate flag and a laugh. My wife once dropped her laptop and was super freaked out, but it actually just broke the monitor. So later on, we were able to hook it up to another computer so we could actually get the stuff off. But no, Dana is, I appreciate you being here because I know you have to redo a lot of work that was in that computer. Dana was actually 110,000 words into the great American novel. No, that's kidding. But she was far into some work that now she has to redo. So we're going to talk some big questions about healthcare. This is something we've done before. I'm sure it's something we will do again. It's just an area you know so much about. So I'm going to throw the questions out, then I'm going to sit back. I'm going to drink water. Let's tell the people it's water. No, it's definitely water. It's only 3 in the afternoon here. So the first question here is, do you think we, and when I say we, I mean the United States of America, not you and I personally, will see a major disruption to how we pay for healthcare?
Probably. And I say that just because the healthcare industry moves so slowly. So, we will see it, but I can't predict when it will be. But, people have been talking about, things, the prices of things for some time, and we are making progress. So the good news is last year, this time, the Center for Medicare and Medicaid Services put in a final rule ruling for price transparency. So that's at least a first big step. So now we at least understand what it is that we're paying for and how much we're paying. And, it's requiring first hospitals. So if you go to a hospital, and it's already going on this year, hospitals are required to list in a user-friendly format prices. So if you go to a hospital's website, you should be able to find that information. Some hospitals even have on their website a phone number to contact, so that if things don't make sense, you can actually talk to a person. I haven't tried it, so I don't know how great it is. And we were talking earlier about customer support phone calls and how painful they can be. So I don't know, but at least that's a first step for people to be aware of what they're paying for. And so I think that's going to move us in the right direction. Again, I don't know how long it will take till we get to there completely, but we are making that first step.
7 or 8 years ago, I went to a walk-in clinic because my wife had strep and I was 99% sure I had strep. This was pre-telemedicine. And I got an itemized bill, and I had pretty good health insurance at the time. I had New York Times health insurance through the Boston Globe, and it was like $500. I waited longer than I saw the person and said, "Don't even give me a throat culture. My wife has strep. I clearly have strep. I'm allergic to penicillin." And he wrote me a prescription, and that itemized bill had about 18 things on it. And it basically taught me everything that's wrong about healthcare. But that sort of leads into the second question, because it's great to think that there's going to be this massive disruption where all of a sudden healthcare is not tied to work and there's some other way to do it. But it's really the little daggers that are sort of killing the current system, or at least giving us some options. So question number 2 is, will efforts by major players like CVS to make healthcare accessible have a major impact? So you can walk into thousands of CVSs now, and they have minute clinics. So they can do things like, "Hey, I don't feel well," or "Could you check my blood pressure?" Like, they're not going to, do the big things, but they can do a lot of things that previously you would have spent significant amounts of money to walk into a walk-in clinic or to see your general practitioner for.
Yeah, no, CVS is doing, I think a great job. So they acquired Minute Clinic, they acquired Aetna.
Yes.
They have, right. So they have the insurance component, they have the care component, and, they're just your neighborhood pharmacy. So, you can go in, get your, if you're not feeling well, you can kind of see a nurse practitioner, get a prescription, pick up your medication, and pick up a can of soup so that you can go home and feel a little bit better, right? So, and there's pretty much a CVS, in close proximity. I would say 5 to 7 miles from most people. So, they are making a really good job with that.
Well, let me ask the sub question there. Is this really just about a mix of accessibility and options? Because previously you get sick, you go to the hospital, maybe in some markets you can go to a walk-in clinic, you could call your doctor and get an appointment. But now I could go to CVS, I could jump online, my health insurance through my wife, I has a telemedicine component. So if I'm having, say, an allergic reaction, or I had a small finger infection a few months ago, and I didn't really need to go sit somewhere in the middle of a pandemic, is it really just about sort of making it so we don't put every medical need into this same hole of like having to go sit in a doctor's office, which costs money, as opposed to the person just talking to you for 5 minutes is significantly less expensive, I would have to assume.
So that's definitely one component. And, it's interesting, the pandemic's been so hard for so many of us for so long. But one good thing that came out of it was telemedicine. And telemedicine has been in the making for many, many years. And it just took so much time for acceptance, right? For it to be fully accepted. And so with the pandemic and people not, feeling comfortable making those in-person visits, it's definitely been great that telemedicine had everything, they had already made that groundwork in order to make it accessible. And now it was adopted. And the good thing is, like we've kind of opened that floodgate and we're not going back, so, there's talk and concern about, like, is telemedicine really here to stay? Just because there's still some unanswered questions about, like, how do you pay for, this cost or, this other thing? And people are still figuring it out. But the Department of Health and Human Services is, they have a telemedicine site set up. So it is something that they are, looking to, keep on going, so that we can, best utilize that. And then, the other thing, just reducing, the cost of care is also preventative care and primary care. So, moving to the point of, being able to have that, chat with your doctor without having to go to the emergency room. The cost of an emergency room visit is significantly higher than a telephone visit. But then also, doing your preventative care. So, preventative tests or just visiting, having an annual checkup with your primary care physician.
Yeah, I've actually heard of people that have done, basically their physical as a telemedicine appointment, along with going in and getting lab work and blood pressure and that kind of stuff, which then frees up the doctor's time. And I know a lot of the times I've had to go to the doctor, or someone in my household has had to go to the doctor, we know exactly what's wrong. Like my son once a year gets terrible allergies, and last year's medicine is always expired by the time it's this year. Happened to us in Orlando. We jumped on a telemedicine appointment. Orlando's a city that has 24/7 pharmacies, as amazing as that is. So at like 11 o'clock at night, we were able to fill a prescription, and he went from looking like he'd been in a heavyweight title fight to waking up and feeling basically normal. I'm really excited about this. And we've talked a lot about wearables. I am wearing, I don't know, Dana, this might be the 14th watch I've bought since knowing you. This is the Fitbit Charge 5. I bought it because it has a nicer screen than the old Fitbit, but it's supposed to turn on when you do this, and it's like 50-50 on that. So I'm pretty much thinking about smashing it with a rock. It is not, I get up in the middle of the night, but that is not what my question is. My question is wearables right now are nice fitness trackers. They're really good to remind you, hey, you didn't take any steps today, or, geesh, your heart rate's not great, but it's anecdotal. It's useful from a fitness. It's not a health device. Do you think we're moving towards a time when these might actually be helping us track meaningful health statistics, including people who maybe have things wrong with them, or diabetics, or they're chronically dehydrated, whatever it might be?
I do. And I think, we already have some of those things. So the FDA has a agency for digital health and medical devices, but also, software as medical devices. So, they're already thinking about this. And the reason why I bring this up is because the FDA is designed to keep us safe, and make sure that, it's a good thing, making sure that we don't get injured by, any of the drugs, foods, cosmetics that we might take. With the, advent of the smartphone and digital health applications, they started to get into that as well. And, if they want people to use these medical devices, wearables, for their health, because, the FDA wants us to be healthy, go figure. And where a wearable or software, may have some risk, they have, set up some regulatory guidelines for that. For most of the devices, the low risk devices, so like, just tracking the number of your steps and your heart rate and stuff like that, they're not going to have that as much. But, things for, we talked about, blood glucose monitoring, so there are devices not necessarily on your, for the general population and like an Apple Watch or something, but, there are companies like Dexcom that make a glucose monitor. So that is, it's a medical device, the software that runs that, that may go, that goes to your phone, that would be regulated because, the FDA wants to make sure that, the software works, that the wearable works, so that that you can do that. And so, they do have this in place. And doctors appreciate that. So there are more relationships. Patients are coming to their physicians with more information because they are able to monitor. And in fact, again, going back to the pandemic, the FDA had some devices and software that they made emergency use accessible to, like patient monitoring, that type of thing, so that patients could, monitor, have that contact with their physician without necessarily going into seeing their physician in person. So we're moving there.
So when we're reading all those rumors about all the cool things the next Apple Watch will do, which, by the way, this Apple Watch did none of those things. And that is where we hit the glitch. Yes, that is where everything glitched out. Dana disappeared, but we'll be back with more Dana Abmramovitz momentarily. Before we do that, it is almost the first of the month. I know that's hard to believe. It is almost November 1st. What happens November 1st? Our new 7 investing stock picks come out. Each of the lead advisors, and that is an incredibly diverse, incredibly talented group of people, make one stock pick, our highest conviction stock each month. We do a major write-up about that. We record a video deep dive. We answer your questions about them in our members only call. So if you are not a member of 7 Investing, you have to go to 7investing.com/subscribe. Once you're there, if you use the code now, you'll save $10. That doesn't almost even matter. It is such a great value. For $49 a month or $399 a year, you get access to not only all of our new picks, you also get all of our older picks. You get everything we've ever done. You also get access to us in members only call and all sorts of other information. That is 7investing.com/subscribe. We also have a student membership. If you are an active student or gifting a membership to an active student, that is $84 a year. If you have trouble getting that to go through, or if you're buying it for someone that isn't you, just send us an email at info@7investing.com. But it is a Friday. I don't want to keep all of you too long. JT Street, if you want to hit it, we will go back to the second part of my interview with 7 Investing lead advisor, Dana Abmramovitz. Okay, so Dana Abmramovitz is back. We had a bit of a technical problem there. I'm not entirely sure where I cut off, so I'm gonna go back to the second part of that question here. This is basically saying this is a pretty high bar for Apple. Well, we hear all these rumors about all these cool things they're gonna do. It's one thing for Apple to say like, hey, maybe you need more water. It's another thing to say like, hey, diabetic, like you need more insulin, right? So this is a pretty high FDA bar to clear.
Yeah, I think so. And, I mean, if a device actually becomes a device, then they either need to, depending on the level of, if class 2, 3 risk, that is going to want either data. So as a PMA, forget what that stands for, or a 510K, which basically means you need to show that the device is as good as what is currently on the market. So there's going to be some clinical study, for a device and software if you're going to actually provide healthcare information.
Yeah, so for those of you getting all excited about what might happen with wearables, realize that they're going to get better at tracking your sleep. They're going to get better at understanding your workout. They're going to get better at all of the sort of entertainment, informational things that can help you have a good workout, or in my case, make me get up and walk for 250 steps every hour, whatever it is. But they are probably not going to replace serious medical devices. That doesn't mean it won't happen. It doesn't mean that Apple might not pick a market and go through all the approvals and do what it has to do, but that is not very likely. And it is very different to take, sort of a fun ECG and actually take a medical grade one. Not that, I don't know why that would be fun for anyone, but that is something you could do on the new Apple Watch. Final question here, Dana. And I know we are tempting the computer gods, given how things have been going today. But what are most investors getting wrong about healthcare?
Oh, I think it's timing. I say it all the time, healthcare moves really slowly. And I was actually presenting at a conference, and somebody from the audience made this really great point, which I've been using ever since. Healthcare moves at the speed of trust, right? And so, it takes a long time to build that relationship and trust somebody. So, it just takes a long time. So, you think about the Genome Project, right? So that was in like late 1990s, early 2000s, right? And we finally sequenced the complete genome, and we were so excited. And I say we collectively, we as at least the scientific community. It was
I didn't help. I didn't help. Just so you know, I had nothing to do with that.
But we're thinking, okay, now we have all this information. We're gonna do this, and it's like 2021, and we're still now just doing some things with the genome. We've made some progress, but that's 2 decades to fully be able to use it. And some of the potential that we thought it had, which still hasn't come to fruition. So I think we as investors think that it's going to happen sooner, oh, this is a great idea, this needs to happen, or we want to have happen, a company is going to do this, and it just takes a little bit longer. So, I mean, it's great for us long-term investors because, we have that, we invest with that horizon. So we're like, okay, this company is tracking to do, these things. And in healthcare, it's great because, you can kind of just see that potential and, just kind of check and make sure that, the company is doing the things in the direction, keeping it in that direction. But I think that, investors, I know a lot of VCs have failed by not, fully understanding that, healthcare is not necessarily the technology industry, and it's just not going to move that quickly.
And I think we've seen the technology industry do a pretty good job on the fringes of healthcare, but it is very different to say we're going to provide telemedicine and then hire a bunch of nurses to go take blood pressure readings and do tests. That's on the edges. That's not a big disruption. And any of the big swings have failed pretty mightily. And that's also because it's such a large apparatus. If you're changing something that the vast majority of us have, I mean, look, most people still go to McDonald's. And I don't mean that from a healthcare point of view. I mean, we have much better fast food and it hasn't unseated McDonald's. So as a country, and I know that's a weird example to tie it in, but we don't change all that easily. And we still have 80 plus million legacy cable customers. As a country, okay, other than newspapers, we were really good about giving up newspapers. We don't, which says the lifelong journalist. We generally have not been quick to change. And we've seen in this country, and correct me if I'm wrong, with healthcare, sometimes people will cling to something, even if it's worse than what they might be getting, because familiar, when it's your health, is really, really important.
Yeah, well, and so it's, people like us as a consumer, are very cautious and bad to change, but physicians are just as bad and not worse, right? Because their whole premise is to do no harm. And if something is working, you don't change it because, there's that level of risk. So, the healthcare industry itself doesn't do risk well. And, normally change brings about, some sort of risk. And so, it's just very, very, very hard to the healthcare.
This is not unique to doctors. And I'll close out here because Dana's glitching a little bit. This is true of every industry. I know countless grizzled old reporters that still use the notebook when their young colleagues are using recording devices and tablets and all. A lot of people just don't want to change, even when clearly what's new is better. And I'm not sure it matters if a reporter takes notes in a notebook or takes notes digitally, but certainly if he has a recording, that's pretty valuable in terms of like, I didn't say that. Well, yes, you did. I didn't just write it down. Here it actually is. So for doctors, I fully get it. You were trained one way, you did it for 20, 30 years. And now some like young kid in the IT department's like, here's your tablet and this thing you wear in your head. And all of a sudden, that's not going to be easy. But Dana Abmramovitz, I recommend not using a computer the rest of the day. Write your report out on paper, maybe have it scanned. It feels to me like the universe is telling you something. But thank you for doing this. I will throw it back to myself.
All right. Thanks, Dan.
That was a challenging interview from a technology point of view. We thank you for watching. It is a Friday afternoon. We will be back on Monday with Steve Symington. We're going to be talking space on Monday. If you'd like to get in touch with us, it is info@7investing.com. If you want to follow us on social media, you can go to @7investing. And if you're there, you can find ways into, I think you can, this cool new thing we're working on. And I don't remember if we announced in public, so I'm not going to say it out loud. So go to @7investing.com and you can interact with us and maybe find some surprises. Mike Fee, Karen, we thank you for watching. Apologies, we didn't take a lot of comments on this show. We will get back to that on Monday. See you soon.